Hi everyone. Since COVID virus is very virulent, merciless, and fatal, we ought to be very innovative in utilizing the technologies to defend ourselves. It is amazing that in a short 4 months' time, we have evolved a fabulous technology to treat the patients effectively and at the same time reduce the exposure to the healthcare workers. Many of you may know that patients with COVID infection can have rapid heartbeat, fever, lack of sleep, and shortness of breath. A company called OURA has developed a ring that monitors the heart rate, temperature, sleep, and oxygen saturation. This information is sent to the patient as well as the patient's primary care physician, which will help them detect early signs of the COVID infection, for which we can do some evaluation. Recently, some of the NFL football teams have started distributing these rings to the players. Similarly, there is also a watch which monitors all these vital signs such as heart rate, temperature, sleep, and oxygen levels, and alerts the patient so that they can go and get the virus testing. Professor Rogers from Northwestern University has invented a device which can be stuck in the upper chest wall, which can also monitor the heart rate, the breathing rate, temperature, and oxygen level. Similarly, a scientist has developed a small chip which can be stuck in the mask we wear, which can also monitor the heart rate, breathing rate, temperature, and oxygen level. In the past 4 months, physicians are not able to see the patients in their offices. Hence, there is an explosion of remote monitoring devices that happen. A gynecologist can remotely monitor the fetal heart rate so that if there is a fetal distress, the heart rate will be very high, in which case the patient can be immediately brought for C-section to save the baby. Similarly, children can be monitored remotely from a different room, particularly since nowadays the people are working from home. The blood pressure, the heart rate, blood sugar, oxygen saturation, as well as EKG tracings can all be monitored from the patient's home by their physicians from anywhere in the world. There is a company called Echo which has developed a digital stethoscope with which the heart and lung sounds can be heard effortlessly. The heart sounds and the lung auscultation can be transmitted to the physicians remotely by the patients, caregivers, or nurses, thereby eliminating the direct contact. These heart sounds can be transmitted through the headphones or the AirPods. Since the heart sounds are transmitted along with the sound waves called phonographs, subtle heart murmurs which indicate leaky valves can be detected easily. Fascinatingly, the same handheld device can transmit the EKG tracings by just placing the device on the chest wall. That's the one you see in the middle of the slide. We can diagnose cardiac arrhythmia, which are irregularities of the heart rate. We have also introduced artificial intelligence, with which there is a condition called paroxysmal atrial fibrillation, which causes strokes frequently, can be detected with great accuracy. This is an example of the patient holding the device on the chest wall, which is transmitting the EKG as well as the phonograph remotely. Since many of the patients do not come to the offices or clinics, these patients' most common conditions such as diabetes and hypertension can be monitored remotely from their homes. This machine on the left side of the slide can monitor the blood pressure as well as the blood sugar. When the patient checks the blood pressure and the blood sugar, these numbers go to the cloud directly from the device, even if the patient does not have internet and Wi-Fi. These numbers subsequently will come to physician's cell phone, which can be monitored by him or her. What you see on the right side of the slide is a real-time message I got from one of my patients. When we click the link in the message, the patient's entire month's reading will show up as a graph, which can be filed in the patient chart. This way, even though we are not seeing the patients, their high and low blood pressure and blood sugar can be detected by their medications can be adjusted. This way, unnecessary hospitalization and associated cost can be averted. In addition, patients' lives can be saved. This slide shows examples of monitoring remotely. The first one is an outpatient with cardiac arrhythmia. The patients, particularly if they have palpitations, dizziness, etc., can monitor their own heart rate from their home. So whenever they have some palpitations, they keep their fingers in the cardiac device, which is transmitted to their phone as a EKG strip, which can be saved and sent to their physicians. This is very effective in capturing a condition called atrial fibrillation, which is one of the common causes of strokes. In the second example, ICU patients who have COVID, we can have an ability to monitor them, particularly since we cannot go into the room more frequently. Without seeing the patient's heart rate, EKG rhythm, the blood pressure, oxygen saturation, respiratory rate, and temperature can be remotely transmitted to the ICU physician's telephone. The ICU physician need not necessarily be confined to the ICU. Wherever he is, he will get this information so that he can immediately detect abnormality and hence he can take immediate action. When the patient is admitted in ICU with critical status, they will be very contagious. Hence, the physicians and other healthcare workers like nurses cannot get into the room more frequently. Hence, they use robots. In the first slide, first picture, the robot is interviewing the patient about his symptoms. Similarly, the same robot can be used for patients calling the nurse or the physician so that they can talk to them. The second photograph, you will see that the physician is able to interview and talk to the patient effortlessly without coming into the room. In this slide, the monitor shows the picture of the patient as well as all the vital signs, including the heart rate, the respiratory rate, pulse rate, all of them in one screen. In the second picture, the nurses can monitor multiple patients, COVID patients in the ICU in one screen. In this slide, you can see the physician and the nurse are making morning rounds. In the big monitor, all the patients' names are displayed along with their vital signs. This way, they can monitor all the patients simultaneously, and the sicker patients can be provided care first. In the second photograph, the nurse is giving IV fluids and medications in one of the patients. As you see here, normally all these IV lines are inside the room at the patient's bedside. But in view of the fact that we need to keep the contacts minimal, all these lines are managed from outside the room. This slide shows examples of using robots for healthcare during COVID era. The first picture shows an interview being performed between the patient and the physician. In the second slide, the robot which is standing welcomes the patient and helps with the registration of the patient. The second robot is a sanitizing robot which cleans the floors. In this slide, we can see the physician is having conference with the family at home. Since the patient's family cannot stay in the hospital due to the COVID, this practice is being done now. The second one is contact tracing. It automatically traces the people who have been exposed to the virus. The COVID patients in the ICU, if they have insulin-dependent diabetes, they will be extremely sick and they need immediate and frequent modulations of insulin drip. So as you see in the abdomen, there is a device which monitors the blood sugar and sends a message to the nurses outside. And the physicians also will be able to look at the blood sugar fluctuations and then adjust the insulin drip remotely from outside. This slide shows example of robot taking the food to the patients, and the healthcare workers are getting their meal utilizing scanning of a code. This slide shows examples of robot which helps interacting with the patients in ICU, and the second robot is delivering medications to the patients. This is an example of robot carrying ultraviolet light to sterilize the entire patient's room. This slide shows that due to the acute shortage of ventilators, the production of 3D printed ventilators are being done. And this is fascinatingly organized by an open source project. Utilizing 3D technology, the face shields and nasopharyngeal swabs are being made. Due to the acute shortage of ventilators, United States government partnered with the private industry to produce enormous amount of ventilators to help the patients in ICU. The companies like Tesla, Ford, and GM participated in this endeavor. As you know, when the COVID patients get admitted to the hospital, they can have multifocal pneumonias, strokes, and heart attacks, for which a lot of CAT scans and MRIs are being done. Since there is an enormous surge of these radiological testings, Alibaba had introduced an artificial intelligence system which detected the patients who had coronavirus with 96% accuracy. Using artificial intelligence technology, CT scan diagnosis is enhanced by 60-fold. Approximately 13,000 tests were performed every day, which is impossible for the human radiologist to perform at this level. Since it is a completely new disease, several countries are doing enormous amount of research work. So it is impossible for all these research work can be analyzed without AI. Over 100,000 published research papers are being analyzed by a consortium called High Performance Computing Consortium. This is managed by many reputed companies such as IBM, Amazon, AMD, Google Cloud, Hewlett-Packard, Microsoft, NVIDIA, etc. During the days of COVID crisis, patients obviously do not want to come to physicians' offices. Hence, many of the insurance companies, including Medicare, have approved telemedicine, which has skyrocketed. Almost every office, including mine, we use telemedicine, doing the calls with video, which is very effective. Here is a picture which shows the physicians examining the patient's wrist. In the second slide, one of the EHR, electronic health records system, shows that in 3 weeks, the number of patients being seen through televisits have increased 15-fold. Finally, the COVID is gone. Now, how will we get out? Thank you very much for watching this video on the topic Explosion of Healthcare Technologies in COVID Era. I hope you enjoyed the presentation. If you do so, please press the like button. I would love to get your feedback. Feel free to forward this presentation to your family and friends.